Hello and welcome to today's presentation on Alarm Management Mobile Learning Module. Myself, Mansi Megwal, student of MSc Nursing Batch 2022, College of Nursing, AIIMS Jodhpur, and today is the day 3, or we can say the last session of this mobile learning module. As in previous session, we discussed about the alarm management practices as per the American Association Critical Care Nurses guidelines for three medical devices as mechanical ventilator, multivara monitor, and infusion pump. And in today's session, we will discuss about the National Patient Safety Goals. When we talk about the National Patient Safety Goals, it is a quality and patient safety improvement program established by the Joint Commission in 2003. The National Patient Safety Goals were established to help accredited organizations address specific areas of concern in regards to patient safety. The National Patient Safety Goals on Alarms. The Joint Commission announces 2014 National Patient Safety Goals in 2013. Alarm management is considered a significant method in improving outcomes and considered a national patient safety goal according to the Joint Commission accreditation of 2016. It consists of two phases. Phase 1, which begin from 2014 to January 1st, 2016, and Phase 2 begin January 1, 2016. Phase 1 is mainly focuses on establishing alarm system safety as hospital priority and identify the most important alarm system to manage. And Phase 2 is mainly focuses on establishing policies and procedures for managing the alarms identified and educate staff and communicate changes. In Phase 1, which began in January 2014, hospitals were required to establish alarm management as an organizational priority. Identify the most important alarms to manage based upon internal situations. Seek input from medical staff and clinical departments. Identify risk to patients due to lack of response and or malfunction. Identify actionable alarms versus alarms contributing to noise or fatigue. Proactively think. Identify potential for patient harm based on internal incident history. And at last, publish best practices or guidelines. Phase 2. In Phase 2, hospitals were expected to develop and implement specific components of policies and procedures that address at minimum. First, clinically appropriate settings. Second, when alarms can be disabled. Third, when parameters can be changed. Fourth, who can set, change, or turn off parameters. And fifth, process for monitoring alarms and expectations moving forward. Sixth, checking individual alarm signals for accurate settings, proper operation and detectability. Seventh, educate those in the organization about alarm policies. Eighth, clinical leadership responsible for ensuring accuracy, safety, education, and communication around new alarm policies. National Patient Safety Goals on Alarm Management, taking further actions to reduce the non-actionables or false alarms. Those actions are as follows. First, to create or participate in an alarm management committee. Second, stress loops on ECG led bias for tremulous patients. As you can see in these pictures, create a stress loop for each lead wire and tap the loop to the patient. Proper stress loop will ensure that any tugging on the lead wire will not pull directly on the electrode connection and can help with decreasing artifact in the obtained data. Third, establish organizational alarm defaults by unit. Fourth, change electrodes daily using recommended procedures. Fifth, add this to daily routine tasks such as baths or care to assure practice change. Sixth, change transmitter batteries daily or when the system indicates the need for them. Seventh, customize individual patient alarms based on assessment and condition to assure alarms are valid. Eighth, customize alarms based on patient assessment and report, verify its shift changes. So these are the actions which are taken by National Patient Safety Goals on alarm management to reduce the non-actionable or false alarms and further reducing the alarm fatigue. So, to summarize today's session, we discuss about the National Patient Safety Goals, the phases of National Patient Safety Goal, Phase 1 and Phase 2, and the actions taken by the National Patient Safety Goal for reducing the non-actionable alarms. So to conclude, alarm fatigue is a problem that affects both patient and healthcare providers. It occurs when there are too many alarms from medical devices, which can cause desensitization from sensory overload and blunting of responsiveness, and alarm apathy, wherein alarms that are oversensitive cause a lack of trust resulting in the intervention being missed. Alarm fatigue can lead to serious or even life-threatening outcomes for patients. Therefore, it is important to have efficient alarm management practices for managing and reducing the number of false alarm or non-actionable alarms, which will further reduce the alarm fatigue. These are my references. Thank you. Any query, if you have in these 3 sessions, you can ask me on WhatsApp group. Thank you for your patience listening.